Now, stakeholders are this evening reacting to the developments which showed that 17 COVID-related deaths were recorded Saturday. We have the details from Dwayne Anderson.
76 patients have died from COVID-19 since the start of May. 17 of those deaths were recorded on Saturday. Opposition spokesman on health Dr. Maurice Guy wants the Ministry of Health to investigate whether a lack of proper treatment at some hospitals is causing the spike in COVID-related deaths.
It speaks to a couple of potential reasons why we're having that. One, it speaks to the management of these COVID-positive cases in the hospital. It speaks to the testing as to whether people who are being admitted to the hospital are being admitted at a later stage of the illness without any testing being done prior to them requiring hospitalization. And it also speaks to the fact that, as we know, that after the spike, those who are infected, you're looking at 2 to 3 weeks before you see the death.
Dr. Guy says he is concerned about the situation in Manchester, where 9 of the 17 deaths were noted on Saturday. 5 of the deceased are men in their 80s. 2 other men in their 40s and 2 women aged 81 and 64 were also among the deceased listed in Manchester.
Well, first of all, we need to know what is it that has caused these deaths. We note with great concern that the majority of them, of the 17 reported today, occurred in the parish of Manchester. And it is something that the ministry needs to do to find out what is the management, the clinical management at the premier hospital in Manchester. How is it? Is it different from the other areas? Is it different from the establishment or the established practices by the ministry?
Chairman of the Southern Regional Health Authority, Wayne Chen, in the meantime, says he will make checks into the recent spike in deaths from coronavirus in the parish.
I have no information to suggest they were together or in any way connected. The fact is that older persons, as we have seen, have been vulnerable. And you know that Manchester has for a long time been a destination, a retirement destination. So we would tend to, from the outset, have a higher concentration of older persons. It might, as I say, be something random because there are many days we have no fatalities in the parish. So it's something I will be taking up with my team tomorrow.
The Health Ministry says another 134 deaths are now under investigation. Dwayne Anderson, TVJ News.